Good afternoon, everybody. Thank you all for joining us today on this beautiful afternoon. Welcome, and welcome, Secretary Kennealy. This is Bill Kennedy, partner here at Nutter, and I'm pleased to host today's webinar with Secretary Mike Kennealy of Housing and Economic Affairs. This is part of the Nutter New Normal webinar series, and we are in the process of working on some programs for the future. We do have a food and beverage program next week, and if you want to go on the Nutter website, you'll see the details for next week. I want to thank all my partners and associates and the folks at Nutter, particularly Jay Wagger and Colleen Bidgood and Eva Skalkos, Stephanie Goldstein for facilitating this today and working with me. Secretary Kennealy, welcome this afternoon.
Well, Bill, thank you. It's great to be with you all today, and I'm so pleased to have the opportunity to describe the work of the Reopening Advisory Board on the reopening strategy, and of course to hear some questions. So great to be with you all today.
Thank you. Before we get into the Reopening Advisory Board, which you co-chair with Lieutenant Governor Polito, yes. I'd like to ask you a little bit about your own secretariat. When I look at the jurisdictions in which you oversee housing, community development, rental provision, small business, banks, insurance, consumer affairs, business regulation, a broad area under your secretariat. When the governor declared the emergency, did your secretariat play any particular role, have any particular plan? Was there a call to action in some way? Essentially, what I'm asking is, what has been the role before you appointed to co-chair the Reopening Advisory Board? What has been the role of the many offices and divisions within the Executive Office of Housing and Economic Development responding to COVID-19?
Yeah, it's a really good question, Bill. It's been, I think, a fairly extensive list reflecting, as you've alluded to, the breadth of the activity the Secretary covers. I'd say first and foremost, we wanted to make sure we were in regular touch with both the business community and the housing community. And so very early on in the crisis, we set up a weekly call with chambers of commerce and business groups around the state, which we continue to do. We get about 100, 150 people on those calls. And we thought it was very important to be in close touch with the business communities. And I've had similar engagement on the housing side of my portfolio, but communication has been very key in that regard. Another area of concern has been support for small businesses. And we, for example, very early on in the cycle, stood up a fund through the Mass Growth Capital Corporation to provide capital to small companies, and then have played an active role helping to facilitate the implementation of the various federal programs through the Small Business Administration and others, and staying in very close touch with our banks and other community development organizations to make sure that those programs are functioning as well as they can. On the housing side of my world, housing stability has been a major challenge during this crisis. And so helping to craft legislation around eviction and foreclosures, helping to bring more capacity for the homeless online, the housing side of this has been an enormous challenge, as you can imagine. And of course, in all this, staying in close touch with our municipal leaders, because so many of our community programs get implemented in our cities and towns, and making sure that they're aware, we're aware of their challenges and trying to address them. So it's been very broad, again, kind of reflecting the nature of the work. I will say one other area we've been deeply involved is on the manufacturing side. And when it became clear very early on that we had major supply chain issues in terms of procuring PPE and other supplies, through our Advanced Manufacturing Collaborative, which I co-chair, we stood up an effort called the Manufacturing Emergency Response Team, which is actively helping manufacturers who want to repurpose their production lines and start making face masks and gowns and shields and other products. And that's been a very successful program. We've had over 400 Massachusetts companies come forward to say they wanted to participate in that. We've had about 27 make it all the way through the program. They produced 3.5 million pieces of PPE to date. So I think a great example of leveraging some of our capabilities around leadership in certain sectors and how we can repurpose those efforts to address issues in this crisis. So it's been a major effort for us, as is for everybody across the administration. I mean, since the governor declared the state of emergency and established the COVID command center. It's been all hands on deck for all of us.
The manufacturing point's interesting. You know, we've passed legislation in the past to encourage manufacturing here to stay in Massachusetts. So it's great to hear that how the manufacturing sector responded, and hope that that response will continue beyond that production, but will maybe make the manufacturing sector even stronger as we like it to be.
Well, I think that's right, Bill. I think in this environment, companies are going to rethink their supply chains in a major way. And we've had, since the start of the Baker administration, we've committed over $100 million in R&D capital for the advanced manufacturing sector. And it's been a very robust ecosystem where it's been government, academia, and industry at the table, focusing on how we can establish or extend our leadership positions in the various sectors of manufacturing. And really having the capital and the relationships in place before the crisis hit, what was a major asset as we tried to redeploy some of those resources against manufacturing more PPE.
Michael, Secretary, we had the Attorney General on last week, and she talked about consumer affairs and some of the scams and frauds and so forth that sadly come about during a crisis like this. Has your office seen more of those as well?
I don't think we've seen too much of that, Bill, in our world. We're hearing about some activity like that around unemployment insurance, which you probably have as well. But in our world and in housing and economic development, I'd say not so much. We'll remain vigilant and on the lookout for that, but not so much at this point.
Yeah, she mentioned some of the college programs, the travel programs, and those kinds of things that got some attention, and some of the other things like that came about. But thank you for that. The housing one is certainly an issue. We're engaged with the Pine Street Inn, and of course they're doing a great job down there, and many other shelters as well.
That's right.
That's right. Thank you for giving us that overview. I'm grateful for that. Thank you.
Yes.
Regarding the advisory board, the Reopen Advisory Board that was created by Governor Baker, when the advisory board was established, could you please describe and discuss for us sort of its mission and objectives, and include there the membership, what areas of expertise were included, and how did the membership reflect the board's process and objectives? If you just talk about when you got started, what were the sort of the marching orders going forward?
Yeah, so our marching orders were over a 3-week period of time to develop a reopening strategy for the Commonwealth that was going to be a phased strategy that would be informed by health metrics, health indicators, and that would be as specific as we could around which industries and which activities would open up in which phase and according to what protocols. And so it was a 3-week effort to get that done. And it was the governor's recommendation that we have a reopening advisory board that would be relatively small, yet diverse in terms of perspectives and sectors and geographies around the state, and then engage deeply with a very wide range of groups. And so we had 17 members on the board, 3 from the healthcare world, 3 from municipal leadership, and 11 from industry, representing all different corners of the state. And that group heard input from many different other organizations that help inform our work. So relatively small group, but very wide engagement across business groups, labor groups, community groups, and others. And that really provided the input we needed for our work. And so if you look at the presentation we have here today, that effectively is our report. That's our strategy. And then there was a lot of other content developed, which is on our website now, around industry standards and protocols and help for businesses to reopen. So that was the overall charge. By May 18th, have the strategy in place and have a lot of the supporting elements in place for companies that are going back to work.
How many meetings did you have? Sound like you had a lot.
Bill, we had literally 45 hours of Zoom calls with all these different groups, 75 different groups. Some of those came together, it wasn't 75 unique sessions, but 75 groups over 45 hours of Zoom calls, and then other meetings where it was just the board. So we spent a lot of time together, and I remain really grateful for the folks who served on the board. In our presentation, we have a list of the members, but it was a very heavy lift for them. And I remain just very grateful for their engagement during the process.
Secretary, how did the health metrics that you mentioned, how do they intersect or maybe drive or collide with some of the business objectives? Is that clear what we're trying to ask? How did those points of view interact?
Yeah. Well, the health metrics really are the foundation for the plan. And the whole idea here is that you open in a phased way such that as more activity comes on, you hopefully don't, frankly, lead to a resurgence in the virus. And then the healthcare system as a consequence might get overwhelmed. And so the thought is to really rigorously track these metrics. And we have some of these in the presentation if we want to get to that. But and they've been on a good trend lately, albeit in the context of an economy that's been largely closed. And so the idea is to keep a close eye on those metrics. And then we established a dashboard which measures how we're doing on those. And those will inform how we move to the next phase. So that's how we're thinking about it. It was very important to us, first of all, not to start the reopening process until the metrics suggested it was safe to do so. And then as you go through this, track those every day, and then be able to make a judgment call. Okay, now it's safe to get on to phase 2, phase 3, and phase 4. That's really how we're thinking about it. And the COVID Command Center now for quite some time has been reporting daily on the metrics they look at. And now we have this, if you want to jump ahead to that on the presentation deck.
Yes, yes. Well, I'm going to turn it over to you and your slides now.
Okay.
I think that's a good jumping off point for me to do that now. And
okay.
So please, I won't interject. So please go forward and thank you. Thanks. Maybe a good time to do that.
Thank you, Bill. Great. Well, actually, why don't we flip back to slide 2 if we could, which is a little bit more context on the plan overall. And we thought it was important to establish this context. We call it the road we travel together. And it looks at the period of time from the state of emergency being declared up till the reopened announcement on May 18th. And we thought it was very important to establish that we are among the hardest hit states. And every state's in a different place, but we're in the top 3, New York, New Jersey, and Massachusetts. And that is, again, speaks to how careful we need to be as we contemplate and execute a reopening strategy. We also wanted to highlight on the lower left here the steps the administration has taken around ramping up our testing capacity dramatically. We'll spend a little more time on that one. Becoming a national model for contact tracing, committed over $1 billion in funding to support our healthcare system, and distributing more than 10.5 million pieces of personal protective equipment. So it's been a very tough period of time. We're among the hardest hit states, but we tried to utilize the levers we have in place to combat the pandemic and its impacts on the Commonwealth. We can go to the next slide. So this is a bit on the groups we engage with. As I mentioned, it was a lot of hours over Zoom meetings over a 3-week period of time. And I'm just so grateful that the groups pictured here below that spent their time with us. It is a very diverse group of organizations representing a lot of different perspectives. And I got to tell you, it was just really kind of an amazing experience to engage with this many groups over a short amount of time. I mean, they truly do represent the strength and diversity of our state and our economy, and their perspective was invaluable. We got great regional perspectives, great industry perspectives, great perspectives from labor and community groups. In addition to the time we spent with these groups, we also received 4,600 pieces of written feedback. So we got a lot of feedback in a compressed amount of time, and that was integral to our establishing our strategy. Let's go to the next one.
When you heard, Mike, the Secretary, was there anything you heard surprising to you? Was there anything that was, were any themes developed with the testimony or the input that you heard?
Well, Bill, I'd say that the thing that struck me time and time again was the readiness and the thought and the care exhibited by the various groups to begin to reopen in a safe, methodical way. There was no illusion from anybody that reopening means going back to the status quo. I think everybody was ready and to act in a different way, run their businesses, run their workplaces differently, respond to different needs in their communities. That there was, and that frankly was why we wanted to have this process work the way it did, which is to get the best thinking we could get from this very diverse group of players. And it was just enormously helpful. We were really very impressed by everyone's readiness to to work together and go back to work in a very different environment.
Thank you.
Yeah. Well, one of the common themes in this report is around shared responsibility and working together to reopen. And we thought we'd highlight here some areas where individuals, government, the health system, employees and employers, things we could all do to make sure this reopening works safely. And we'll talk about the fact that it is a phased approach. And it's really incumbent on all of us now here in phase one that we do the things we can do to make sure phase one goes smoothly, and that'll get us onto phase two and beyond. But we wanted to be reasonably specific around what are the things we can all do to make sure this reopening is safe and that we don't have a surge again in the virus. For individuals, there's a set of what we call social guidance. We'll talk a bit more about that. Clearly in government, we have a lot of responsibilities here on things we can be doing. The healthcare system will continue to monitor progression and ensure it's got enough capacity to meet needs. And there's a lot of shared responsibility among employers and employees. And we tried to be very specific in that regard as well. We'll spend some more time on that. Let's go to the next one. So here's the data we talked about before. And the command center has been reporting daily on this data. And so here are some really important data points here. 7-day average of positive test results, 3-day average of hospitalizations, number of hospitals using surge capacity, and 3-day average of deaths. And as you can see from April 15th, these have all been in a very positive trend, albeit again in the context of a lot of activity having been shut down. And so this was what really led us to say it is now safe to begin a careful phased reopening strategy. We go to the next one. A little bit about testing. It's really a critically important part of our strategy that we ramp up testing. The strategy articulated here is test, trace, isolate, and support. We have now the capacity for 30,000 tests per day. We anticipate ramping that capacity to 45,000 a day by July and 75,000 a day by December. And I think it is just a critically important part of reopening that we can test in the most robust way possible. And there's been a lot of great work in that regard. There is some difference now between capacity and what's actually happening in testing. There's really a few different components to the testing framework. One is lab capacity. We have the capacity now for 30,000, but there's also specimen collection and transportation and some gaps we need to fill in there. So hence the gap between the 30,000 and what's actually happening today. The tracing strategy, I think, is really interesting. And we've become really a national leader in tracing. It was on April 3rd that the governor announced the creation of the Community Tracing Collaborative, working with our Department of Public Health and the Boston-based health nonprofit Partners in Health. And we now have ramped it up where there's been over 100,000 contacts made throughout the tracing program. And it's been really interesting to watch. The idea is if someone tests positive, you try to trace what their contacts have been and follow up with those folks. And, there's been a lot of guidance now about maintaining distance. And so when you find someone who's tested positive, you ask, how many folks have you been in close contact with? And the average number people have reported has been just over 2. And that would suggest that folks are taking the distancing suggestion seriously. I think this tracing program will be very important as well. Let's go to the next one.
So
Sorry, Bill.
That seems to say that these different procedures, testing, social distancing, and so forth, they're all very impactful to one another.
Yes.
And interrelated.
It's absolutely right, Bill. If you have the distancing guidance married with the testing and the tracing, that really is how you, from a medical standpoint, a little outside of my field, but from a medical standpoint, that really is how you combat this. And I think all those elements, the distancing, the testing, the tracing, I think in so many ways that explains why those metrics have been going down, they've been going down the last month or so. It would be a little scary to contemplate what those numbers would look like had we not put those things in place. But that explains, I think, why we've had these positive trends for the last couple months, or last month or so.
Thank you.
Yeah. A bit more on data here. So as I mentioned, the daily reports of health metrics will continue. We also thought that now that we're in reopening, it would be important to communicate kind of a dashboard here. So a red, yellow, green framework. And we isolated 6 metrics we thought were particularly important: the positive test rate, deaths, number of patients in hospitals, health system readiness, which is sort of a composite of a bunch of metrics, but trying to measure health system capacity. Again, the goal here being not to overwhelm the health system with COVID cases, testing capacity, as we talked about, and contract tracing capabilities. And you see here, green means positive trend. We're on a positive trend on a couple of those. A number in progress, there's no negative trend. And this will get reported on weekly, this dashboard. And it will very much inform our readiness to move on to phase 2, then ultimately phase 2, 3, and 4. Let's go to the next one. Again, this theme of guidance, I think it's just been critically important that the governor, the administration has done a great job providing this kind of guidance to the public. There's the social guidance for individuals around covering your face, washing hands, maintaining distance, being vigilant for symptoms, staying home if you feel sick. And there's a couple different layers of business guidance as we enter reopening. We'll talk some more about these, but mandatory workplace safety standards. We developed these and they're meant to be applicable for all types of workplaces. Things that we thought would apply and be important for really any workplace of any kind. And then sector specific protocols and best practices. And a lot of that work came out of our discussion with industry groups. So by industry, looking at, one, you get the mandatory standards that cut across all industries, but then specific to any certain industry, what are the things that industry needs to do to make sure their return to work is as safe as possible? And we have a lot of content. We'll talk a little bit about this in a minute. There's a lot of content up on the reopening website that spells out these safety standards and sector specific protocols and best practices. But I think it's been very important to have this level of guidance, and will be important as we now proceed to reopening. We can go to the next one.
What you're saying is there's common guidance for all industries, and then
Yes.
for particular industries, there are specific guidance. So manufacturing versus a business like a law firm versus a bank, whatever it might be. So there's common that we all must do, and there's some that others must do.
Yeah, exactly. That's exactly right, Bill. And so the idea of maintaining 6 feet of distance is really important for everybody. And then you might ask, well, geez, how does that apply on a manufacturing floor? How does a restaurant configure its environment to maintain that kind of distance? How does it work in a retail store? In a lot of ways, the sector-specific guidance is the implementation of the common standards. Very specifically, how do you maintain distance and adhere to the other standards in the unique environment that industry represents?
It's particular industries. You raised that the restaurants, of course. The question is what's it going to take to give people confidence? One I want to ask you about is public transportation. Of course, you do a whole section on that.
Yeah.
But guidance is one thing, and the confidence is another. And I know you're concerned about that as well.
Oh, I couldn't agree more. It's really important. And as we'll talk about some of the communication materials we have for businesses to communicate how they're working within these standards, I think it's very, very important. It's important for the consumer and our consumer-facing industries. It's important for employees in all industries. It's important for visitors. But you're right, we have to establish that confidence. And it does come back again to maintaining adherence to some of the guidance we've outlined. And so, for example, on this page here, we've had this stay-at-home advisory for some time, which was revised on May 18th, and the governor announced a safer at home advisory. And it looks a lot like the stay at home, to be honest, but it really is meant to reflect the fact that there's a wider range of things that are open to do. And so it talks about the fact that folks should travel to the activities that are now open, but really at the end of the day, you're safer at home. And that is particularly true for folks over 65 or folks with underlying health conditions. And so it's meant to reflect that, yes, that there's a wider range of activities, but we still are in a very, a time we have to be very, very cautious. And that's meant to be reflected here in the safer at home. It also calls out specifically that residents are required to cover their face and if they can maintain the 6 feet of distance. So this remains very, very important guidance. And I think probably will be throughout all phases of the plan. We can go to the next one.
For that.
Yeah. So here are the mandatory standards, and the governor actually announced these on May 11th, the week before our report came out. And there's 4 components here: social distancing, hygiene protocols, staffing and operations, and cleaning and disinfecting. And I will say, from the time those were announced up until today, in all the discussions I've had with industry groups and others, nobody was surprised by this list. I think people were anticipating something like this. I think in so many ways, industry was ready to work in this way. Back to my comment before about the high degree of readiness we heard on our calls. And so these were sort of no surprises to anybody. I think people view this as almost a little bit intuitive now in the new environment we're in today. Let's go to the next one. So a bit more about this industry guidance. If you were to look on our website for the industries that are now open today, manufacturing and construction, for example, you're going to see a lot of material. And the idea here is, if you're operating a company in those industries, a workplace, you have a sector circular, as we call it, which summarizes all the mandatory standards and the recommended best practices. You've got a pretty easy to use checklist. And so as you're configuring your workplace and operating day to day, you've got a pretty easy to understand checklist to help inform how you should do that. And the thought here was just to be as clear as we could and make these as easily adaptable as they possibly could. Now, this note down here in the bottom, obviously we've had a number of workplaces that have been operating all during the pandemic, businesses that were deemed to be essential. And the idea here was that on May 18th, of course, the essential businesses continued to operate, and they would have a week to say that they can meet these standards. And we'll talk about how that works in a few slides. But the idea here is to be comprehensive and clear about what we felt each workplace in these industries had to do to maintain safety to the extent possible.
Mr. Secretary, during a few calls that we've had, trade associations that I'm on, the issue of liabilities come up.
Yeah.
Was that an issue that the advisory board heard about, considered? Liability in terms of property owners, but also employers and so forth.
Yeah. Well, Bill, we certainly heard about it, and there's really not much we can do as the executive branch of government. That would have to be a legislative solution. And
right.
But we certainly heard some concerns in that regard. I think what we tried to suggest to people is that if you want to, not to give detailed advice on this matter, but if you want to minimize your liability, I think one way to do that is to make sure you're compliant with the standards. And we'll talk about some of the communication materials we have in that regard. But that was our general advice was, we understand it's a concern, but let's try to have a very robust set of standards in place and communicate how you're working within those standards. And perhaps that might be some way to minimize liability.
That's why I thought that might come up. Thank you. Thank you.
Yeah, of course. Well, on slide 14, we have this phased approach. This was actually part of the governor's announcement a couple weeks ago as well. The thought that we would work in phases, a phase one start, which we're in today, going on to a cautious phase, a vigilant phase, and then what we're calling the new normal. We were careful not to say back to normal, but a new normal. And I'll tell you, one of the hardest parts of this whole exercise is trying to give people some idea of timing in an environment that's just inherently very difficult to predict. And so we did not want to put hard dates on phases. And so we've suggested here is that each phase will last a minimum of 3 weeks, but could last longer before going to the next phase. And importantly, on the next bullet, we say that if public health data trends are negative, back to that dashboard and the data we're looking at, we may need to return to an earlier phase. And that may be specific to an industry, a region, or hopefully not the entire Commonwealth. But it's a very important part of this framework that, again, we're going to monitor data carefully, and that will inform when we get to the next phase. It's our best estimate that these phases will last at least 3 weeks, but they could last longer. And it does, Bill, back to your question before about the importance of data, it is really all about the data. And we've tried to message very hard, it's not about dates, it's about data. And the data will tell us when we progress on to future phases.
In the 3 weeks, is that based on the quarantine period and so forth, or is that based on data itself?
Yeah, it's a great question. A little bit. The thought here is that you really need 2 weeks of good data to measure where you are, because that's how long it takes the virus to really show up. And that does match up with a 14-day quarantine. So the medical folks would tell you that that 2-week period of time is important in terms of monitoring the transmission of the virus. And so, and we've seen other states adopt this as well. They'll say, geez, it's 2 weeks to really take a hard look at the data and then maybe add on another week and provide some readiness for the next phase. But again, I can't overstate it. It really is all about the data. If we don't have a successful phase one, we're going to be here for a little while. And that again gets back to the idea of shared responsibility. The folks, if they do what they can do, hopefully that data continues to trend positively, and we get on to future phases.
That's really the theme throughout this, is the shared responsibility. If we want these phases to go as scheduled, we have to adhere to the policies. That's really the theme that you're saying.
It's a very important theme, absolutely. Yeah, that's right. Let's go on to the next one. So in terms of decisions on which industries would open in which phase, we looked at a couple of things. One is this analytical framework here, where you measure the economic impact of reopening against the public health risk of doing so. And the public health risk can be explained as contact intensity or percentage of public facing roles. And this explains in a lot of ways why in Massachusetts and other states, some of the first sectors to open were manufacturing and construction, for example, as opposed to retail and restaurants and more customer facing activities. And so that was really the construct we used. And as you can see, we've got some illustrative industry sectors here. All these industries are different, both in terms of economic impact and public health risk. And the thought here is start in a relatively small way with industries that have lower contact intensity, and then work your way up into a phase four. We've got a much more, much wider aperture encompassing a lot of different activities of varying levels of risk and impact. So that was the analytical framework. We also mentioned up top that we spent a lot of time in discussions with other states. And so we're part of a group of 7 states that have been collaborating and comparing notes on this. I talked to my counterparts in those other states a couple times a week. It's been a very helpful framework to inform on best practices and what other states are doing. But I say that again with the caution that every state's different, and only a couple of states have been as hard hit as we have. But the combination of this analytical framework and our benchmarking against the activities of other states really helped inform our view on which industries would open in which phase.
Yeah, the other states, is it the density like New York or New Jersey that are common to us, and they had high number of cases as well?
That's absolutely right, Bill. I think if you look at population density among the 50 states, I think New Jersey's first, and I think we're second. Obviously, around New York City, there's a lot of density. Upstate New York, not so much. But population density does explain a lot of this. It's a really good point. And so, as I talk to my counterparts, the other 6 states: New York, New Jersey, Pennsylvania, Delaware, Connecticut, Rhode Island, we're all a bit different. And obviously, we share borders with some of those. But that the density has had a dramatic impact on the transmission of the virus, and that does explain a lot of these differences. On the next 3 slides, there's a lot of content here. I won't try to address it all, but what we tried to do here was provide a point of view on what would open up in each phase across a number of dimensions. And so you see the social guidance we talked about now. That really extends across all 4 phases in our view. I think that's going to be important throughout the process. We have guidance for high-risk populations as defined by the CDC, guidance on gathering size, which today remains less than 10 people and will be determined based on trends going forward. Travel advisory, you see the stay at home becoming safer at home in phase 1. The quarantine for 14 days will be with us, I think, through phase 2. That said, we're opening up hotels in phase 2. So there's some guidance here on travel and how we look at that. If we go on to the next one, worship, houses of worship are open on May 18th with guidelines. We said there could be up to 40%, but you've got to maintain 6-foot distance. And then the businesses, and we can spend some time on this one. So there were 3 different dates in phase 1. It was May 18th last week, where the essential businesses keep operating, and then manufacturing and construction come back online. This week it was lab space, a lot of which continued to operate as essential, office space, some personal services, and then remote fulfillment and curbside pickup for retail, and then offices in Boston on June 1st. Now in the offices, I want to make a couple points. We have put a capacity limitation on the offices of 25% of employee headcount, But probably the most important area here for the offices is our strong suggestion that folks continue to work from home if they can. And that has been really important for a couple of reasons. One is to limit the transmission of the virus in the workplace. But the second is not to overload public transit and childcare and other critical enablers of going back to work. And we've been very pleased with the response so far on going back to work. There were a number of companies, the governor announced this, I think, a couple of weeks ago, that are sort of committed to maintain the work from home protocol. And that will be very, very important here in the early days of reopening. We've been very happy with the response there. And then you see in phase 2 and beyond, some of the more consumer facing industries open up, retail, restaurants, lodging. And then you get into some other activities that are where the contact intensity is greater here in phase 3, and phase 4 is resumption of full activities as we hit the new normal.
The Secretary, on the working from home, did you hear or did you learn how successful or challenging it has been? Has it generally been accepted? Have the employers found it's working well, and so forth? Can you give us a sense of what you learned, if anything, about working remotely?
I'd say, Bill, almost universally, folks have given that pretty good reviews, that they feel like it's working for them. In a lot of ways, they've not done it at scale before. And by the way, this applies to state government too. A lot of us are working at home, and that's never really been done before at any kind of scale within state government. But no, I'd say the perception there has been pretty strong. I think for the most part, employers feel like it's working okay. They've been pleased with the productivity of it. They probably don't view it as a permanent solution at the kind of scale it's at now. But for the most part, people feel like it's working okay for them.
Thank you.
Yeah. Let's go to the next one. And so to wrap up this part of the presentation, that there's the health and human services industry, and we talk about how the healthcare industry will open up with hospitals and community health centers back on May 18th, and this week, additional healthcare providers. The theme here is that these areas should open up to provide high priority preventative care. And so they've been largely closed, but also recognizing folks need to be accessing the healthcare system, and that things that folks may want to have done now, if not done now, could become much more urgent later. And so this theme of high priority preventative care is really what's governing the view of what opens up in healthcare and on what basis. And then, of course, as you get to phases 2 and 3, expanding ambulatory in-person routine care and less urgent preventative services. But here in phase 1, it's a wider range of services available, but this theme is high priority and preventative. And then with regard to recreation and outdoor, I'd say in phase 1, outdoor is probably the predominant theme. A wider variety of activities open up that revolve around the outdoors, and then getting into sports in phases 2 and 3, with more athletic fields open in phase 2, youth sports really for practices and drills, a youth sports competition resuming in phase 3. But you see how this trends in recreation and outdoor going from phase 1 up to phase 3, and then of course full resumption of activities in phase 4.
When it came to the phases, Mr. Secretary, when it came to the phases within the Commonwealth, did you hear, was the testimony different from the urban areas, like some of our major cities, Boston, of course, Lawrence, Holyoke or Pittsfield, versus the more suburban areas or rural areas? Did you hear different things from different parts of the state?
Well, we did, and we certainly heard more concern in the urban areas. And on the one hand, a lot of concern about their Main Street businesses, their small businesses, which are having just a very, very difficult time right now. But on the other hand, real concern about virus transmission. And so, yeah, I think a lot of our challenges, there were challenges everywhere, but that was a level of concern we heard from the urban areas, that on the one hand, getting these businesses back up and running was important, but also in some cases dealing with just a very difficult moment in time with the virus. So yeah, the feedback did vary, and there are some regional variations around the state in terms of the virus numbers. And we did spend some time talking about, do we reopen on a regional basis? And you're seeing some of the larger states do that. New York is doing that. Texas has done that. it was our view that the reopening ought to be statewide, because we're not that big of a state. We do have rural areas and urban areas and some variation, as I said, about where the virus has gone. But our view was, let's have a statewide reopening where all industries would open at the same pace across the entire state.
Thank you.
Yeah. On 19 here, a bit more detail on phase one. We're obviously into that now, about 9 days in now. So that's where we are now. Maybe we'll go to the next one. A bit more in healthcare. Again, this idea of industry protocols. On the lower left, we talk about some of the requirements healthcare providers must meet to be able to open. And this idea that there's got to be a clinical determination that what's being offered cannot be accomplished through telehealth. I will say, similar to my comments on work from home, I think telehealth has gotten reasonably good response as well. And the thought and hope is that that will continue. But for services now, it's got to be something that cannot be provided through telehealth. And again, it's got to be a high priority preventative service at the judgment of the clinician.
Secretary, on the healthcare industry, could I ask you, of course, they were front and center during this crisis, of course, and we're grateful for that.
Yeah.
And they did not provide really any elective surgeries or services, and therefore a tremendous loss of revenue to many hospitals. And lastly, the reports were that people didn't want to go to the hospital, or as a result, didn't get care for which they should have received some care, and that was their choice.
Yeah.
How does, and this is a different question in one way, but the healthcare industry really has to sort of, I don't want to use the word rebound, but it's so important that it gets back to its excellence and it's functioning as we like it to be.
It absolutely is for the reasons you mentioned. On the one hand, there's a business model consideration, if you will, about the range of services offered, and the revenue to the healthcare system. And that in a lot of ways explains, as I mentioned early on, that the $1 billion of funding to support the healthcare system that the state's provided. But you're right, that there's a business model consideration, and there's also an individual wellness consideration that people need to get back to visit their healthcare providers. That you can't put things off forever. So you're absolutely right, Bill. And obviously, healthcare in Massachusetts, it's a critical enabler of all of our lives. It's also a critically important industry. I mean, we are a national leader, and thank goodness in this environment. But you're right, we have to look out for the healthcare system in that regard.
Thank you.
Let's go to the next one. A bit more on the industry content, if you will. So for each industry that's open, there is a control plan template, and the expectation is that companies will take this and develop a plan for how they're going to operate in this environment. And then we have a variety of communication items, and these are all on the reopening website. This is all part of the content developed over this 3-week period of time. But posters that could be displayed in the workplace that communicate to employees and visitors and customers about what the workplace is doing to maintain safety. And Bill, back to your question about confidence, I think this is really, really important, that a workplace can communicate to the folks who are there that they're doing the things they need to do to be safe. And on the second line here on the slide, we call this a mandatory self-certification process. And so there's not a need for businesses to develop a plan and submit it to us or to the municipality, but they've got to take these materials, develop a plan, have these materials on site, where if someone does want to come by, a local health inspector, for example, and inquire about how the business is operating, the business manager will have these materials and be able to say what they're doing. And so we wanted a process that was going to be robust with high standards, but also not slow down businesses who wanted to reopen. And so hence the idea that we're not going to have inspections ahead of time or a process like that, but a very clear set of standards and a way to communicate those standards and how they're being reflected in the workplace.
But is there enforcement?
There is enforcement, and enforcement is through a combination of the municipality, local boards of health, as well as our Department of Public Health on the state level and our Division of Labor Standards. So enforcement is a joint local and state effort. And I will say, among all the groups, we talked to many groups in this process. As I mentioned before, there was very close engagement with the municipal leaders as well. We had 3 municipal leaders on our board and a lot of conversation with the MMA, MAPC, and others. So we're really working on this in partnership with our cities and towns, as we do pretty much everything.
Are there fines and penalties, or just adhere to the program, put the signs up, inform your employees?
Yeah, there'll be a warning for sure at first, and there'll be some kind of escalating set of fines. But we really do think businesses are going to do the right thing here, and we're really trying to help them again by being very clear and comprehensive in these standards. And in the early days here, we're very encouraged by that.
Labor unions must be important in the enforcement.
Oh,
I assume.
Absolutely. We had a number of labor groups come and present to the board, and we engaged with another probably 15 or 20 others in various conversations. But no, it's absolutely important, Bill, for sure. That's right. And the idea here is to provide safety for everybody, for the employer, the employees, customers, and visitors, that it's a safe environment, as safe as possible. It's no guarantees, but as safe as possible by trying to get these standards out there.
Thank you. Thanks for that.
Yeah. So the next few slides deal with what we call the enablers of getting back to work, and childcare is clearly one of them. And I will say, in a spirit of candor, this may be the hardest part of the puzzle, because the childcare system was almost completely upended by the pandemic. We have had typically 250,000 seat capacity within the system. We now have a 10,000 seat emergency childcare system, of which only 35% is being used, by the way. But there are real challenges here in terms of how do you maintain childcare when you're trying to maintain distancing, for example. And so the childcare facilities have been closed till June 29th. We have stood up this emergency system, of which there's a fair amount of capacity in that. But this is very much a work in progress. How do we stand up enough childcare such that the supply matches the demand as we go through the phases? So there'll be more to say on this one, but there are frankly real challenges here in terms of getting that capacity back online. We also talk a bit more about summer camps here, and there'll be more to say very soon on that one. And the thought being that recreational day camps could open in phase 2 and residential camps in phase 3. And as with childcare and all other activities, there'll be a pretty clear set of protocols and standards for how those can operate. So that's where we are on camp and childcare, but more to come on that one in the coming days.
Secretary, did you happen to hear testimony from schools and colleges? I mean, we're hearing things now about, some colleges are going to try to open. Notre Dame, of course, is going to come back in mid-August, and then its semester before Thanksgiving. Boston College announced last week they're going to open. Other schools, did you hear any input from them, and also the regular public schools and private schools, K to 12? Did you hear from any of those folks?
Yeah, we sure did. There's a K through 12 working group being run by Secretary Pizer, and then there is a higher ed working group being chaired by Lori Leshin from WPI, the president of WPI, and so they've done a lot of work on this, and there will be a lot more to say in the coming weeks on that one. Obviously, the big decision both for K through 12 and the colleges is what does the fall look like, and then return to campus in the case of the colleges, and return to school in the case of the K through 12 schools. So there'll be more to come on that, but there are very active working groups addressing both K through 12 and higher ed.
It's just so hard to imagine, we sit here in May, that school might not open up in September, and yet that's a very real possibility, or at least being discussed. Thank you for that. Thank you very much.
Yeah, absolutely. Let's go on to the next one. A couple slides on public transit. There's a few points we wanted to make here. One is that public transit by its nature does create risk of transmission. And again, this theme of shared responsibility, the T, its riders and employers and employees can all play their part in trying to reduce that transmission. Riders by wearing face coverings, and making an effort to maintain distance, and of course not using the public transit system if they're exhibiting symptoms. Employers have a role to play here in terms of encouraging staggered work schedules and back to the work from home policies again to reduce demand. Again, we have a supply demand dynamic here as we do with childcare, and all the protective measures the T is taking around disinfecting and cleaning and providing protective supplies to workers. These are all really, really important. And so we wanted to spell out some of that here on this slide in terms of, again, shared responsibilities and the steps the T is taking to try to be as safe as possible. And then on the next slide, what we wanted to be clear about was the capacity on the T on public transit as we go from phases 1 through 4. And so as you can imagine, ridership is now very, very low versus historical norms. And accordingly, there's a limited schedule or more limited schedule on public transit. So a Saturday schedule across most lines, that will be unchanged in phase 1. And as you see, capacity ramps up going into phases 2, 3, and 4, and finally a full schedule for some lines in phase 3 and some and all in phase 4. That's how we're thinking about the T.
Yeah, the T, the ridership has gone down almost 90% or 95% if you looked at a chart.
Yes.
And so to get that ridership back up, of course, is important to the T revenues and so forth. And then people I know who have had to go to work have become spoiled with the traffic or lack thereof. And now if we have a return and if folks don't have confidence in the T, we may go back to that same traffic situation, which I know is never going away, but people who I know who have gone to work are gloating about how quick they can get into work from their home. It's been kind of amazing.
Yeah, it is a different world in that regard, but your point is a good one. We would not want to see a lot of people getting back to work, not feeling like they can ride the T and driving instead. There's again that work from home is very, very important as we manage the early phases here and ramp up capacity on the public transit system. We heard a lot of feedback about the need for supplies in the workplace, protective supplies, hygienic supplies, sanitation supplies. And we tried to address this in a couple ways. Again, this is all on the website. One is providing some educational materials that helps define what an employer should do to prepare their workspaces and what products are appropriate for employees to protect themselves. And some of this is guidance on what we think is necessary, and some of it, frankly, is guidance on what we think is not. And so we want to be clear, for example, the medical grade face coverings really aren't necessary outside the healthcare system. There's a variety of other face coverings that could be used that are, frankly, easier to procure. And on the procurement side, what we stood up here was a portal on the website where a workplace can find vendors of products and contact them directly and purchase those products. And we do highlight again here in the lower right, this manufacturing emergency response team and the work done there to get Massachusetts manufacturers to produce more of these supplies. I think the next couple slides do deal with education, both K through 12 here. There's frankly not a lot of news on this slide. This K through 12 schools are closed at the end of the school year. They should continue to offer essential non-educational services, and remote learning should continue with an eye towards an announcement about the fall at some point soon. And then for higher ed in phase 1, our higher education institutions can open up their research laboratories and similar facilities. And then a lot of work being done, Bill, as you alluded to, about what does the fall mean for our colleges and universities. So a very strong working group looking at that, and a lot more to come, both on K through 12 and higher ed.
On the colleges, of course, my question was focused on kids attending college, but you talk about an economic engine. Our colleges and universities, the amount of employees, the amount of research work, the amount of economic activity that's spawned from our schools and colleges, if they don't get back to where they were, that's a big loss for us.
It sure is, Bill. It's like the healthcare industry in Massachusetts. It's a wonderful asset and a big part of our lives, and also just a big part of our economy. You're exactly right. A little bit more about the website. I encourage folks to take a look at that. It's got this report on it. and then all the mandatory safety standards, the sector-specific protocols, the templates and other things we put up there, as well as some more information about the reopening advisory board. And then if we go to the next slide, it's got the list of the board members. And again, I really can't thank them enough. They invested a lot of time with us, and their expertise, their professionalism, their insight was just extremely important for the development of our plan.
Going forward now, I'm going to combine a few questions, if I could, Secretary, before we have to leave. Going forward, the role of the advisory board, are there any particular messages or clarifications that you'd like to make or emphasize for us? And then I just have one final question. So if you just wrap up a couple together, I'd appreciate that. Thank you.
Sure. Well, on the board, we had our last formal board meeting was the Saturday before we released the plan. We're going to check back in with them at some point this week. I think we will ask them to continue to be our eyes and ears on what's happening in their communities, among their constituencies as we go through reopening. It's such a talented group of people that are really invested in their communities and their fields. So we view them as really important folks to stay in touch with. I think I could imagine we'll have some occasional meetings, but in a lot of ways, the real heavy lifting is now behind us. But an important group of folks for us to stay in touch with during the process as we go through the process.
I have one final question, Secretary. Thank you for talking about the advisory board. As we end this webinar, and I've raised this question before, it's about how should we be hopeful about the future. As Secretary of Housing and Economic Development, what is your sense about the Massachusetts economy? Are you hopeful that we will recover? We talked the other day, and I used the word with you. How do we restart? How do we restart the economy? Could you just share your sense as the Secretary of Economic Development for us, going forward, how should we be hopeful about the economy restarting itself?
Yeah, well, Bill, I'm extremely hopeful. If you look at where our economy was before the pandemic, we had 2.9% unemployment. We had labor force participation at all-time highs. We got some of the finest colleges and universities in the world-class academic research centers and medical centers. We're a global leader in life sciences and software and advanced manufacturing and other fields like clean energy and financial services and the maritime economy. But we have so many underlying strengths in this economy, and we're all playing a very difficult hand right now. But I think as we enter a period of economic recovery, I think all those strengths come back to the fore. We have a lot to be thankful for here in terms of what are the critical drivers of our economy, and I think those will see us through. And I will say, one of the reasons for hope, frankly, as we get through this, is just watching so many different industries rally to the cause, if you will. We talked about our manufacturing companies committing to manufacture and supply PPE. We've seen our life sciences industry respond in a major way, working on new therapeutics and vaccines. Our healthcare system has been a vitally important player in all this. Local government, the work of our municipal leaders. Our banks, you look at the implementation of these programs from the Small Business Administration, the workload on our banks to get those loans out the door, our housing community, our business groups that I talk to all the time. It really has been just an incredible team effort. I think that should give us a lot of optimism for the future as well.
Thank you very much for that. And I want to say thank you. And if you want to make any closing remarks about the advisory group or any other matter, please be my guest. We're all grateful for you being with us today. So if you want to make any closing remarks, please feel free.
Well, Bill, thank you, and great to be with you all today. And I just reiterate again, this remains a very challenging time. We all have a role to play. It has been, frankly, inspiring to see the number of folks come forward in this effort, all the industry groups I mentioned and many others. We're in this together. We'll get through it together. And please know that you've got an effort here that is comprehensive, where we're listening and learning as we go. And we absolutely will come through this. So thank you all for your time today.
Thank you, Secretary. Appreciate it very much. And thank you to everybody on the call for joining us today. Goodbye, and I hope everyone please stay healthy and safe. Take care now. Thank you.
Thank you.
Bye. Bye, Mike. Thank you.
Okay. Thank you, Bill.
Bye-bye. Thanks.